Are you a member of the sandwich generation, meaning you're looking after your own kids and your parents need a helping hand? Maybe you've got a mom or dad or aunt or uncle who needs some individualized home help. Well, Bayshore Home Health is here to help you. Polina Phillip, registered nurse, is going to tell us about some new programs. How are you, Polina?
I'm good, thank you. We at Bayshore truly believe that prevention is a way to your wellness, and we can prevent a lot of things from happening. That's why we designed a My Nurse program that works on management your health at home, and it's to keep people as healthy as possible for as long as possible and independent at their own homes.
Independence, is this the main concern when children of elderly parents come to you and say, this is what my mom or dad need? How significant is independence?
Independence is very significant. It's a main problem. People don't like to lose their independence. They like to stay independent as long as possible. And sometimes by giving them a little tips and giving them a little help can make a huge difference.
Well, certainly keeping your parent at home is, as you've said, very significant to their health. So how does this new program, My Nurse, work?
My Nurse, it's a regular home visit by registered nurse that's done monthly or quarterly. It's checkup on the patient health. It includes physical assessment, medication review, nutrition review, home mobility assessment, fall risk prevention as well, because we know that it's very important to prevent things. Again, I'm underlining the word prevention before something happens, before something leads to injury like falls or complication of current condition or illness and lead to hospitalization.
Well, if having in-home visits is so significant, why is it such a difficult thing to have your elderly parents see the same doctor all the time? What are the challenges there?
The challenges are sometimes some elderly people, they have mobility issues, and it's hard for them to go to see their family doctor as much as they want to. And home visits can really help because they don't need to go anywhere. Basically, we come into them, and we see them at their own home. Very important when they go to family doctor as well. Very important to bring all the medication and all their concerns and questions. Sometimes they don't do that. When we visit them at home, we can really see what medications they're taking, for example. We can do a nutrition assessment and see if there is a problem there. We can see if they need a little bit help. Let's say they need a light housekeeping, or they need a little company, or shopping, or a little help with cooking. That's all the services we can provide as well.
It sounds to me like having a healthcare practitioner come into the home gives you a window onto the health that maybe a visit to the family doctor can't? It cannot replace visit to family doctor, obviously, but it can be extension of family physician practice at your home. We're working in constant connection and collaboration with family physicians. After each visit, we provide a report to the family members that want us, basically elderly people or the family member asking us to provide the report to them or to physician. We like to be basically extension, and we like to involve family physician in everything that happens with patients. Also, we can definitely help definitely help people that don't have family doctors or have difficulty to visit them as much as they need to. It sounds also that this is a great comfort for family who doesn't live perhaps in the same neighborhood or maybe even in the same city as their parents anymore. Is that who you find is making use of the My Nurse program?
Definitely. A lot of children now worried about their parents, that they live 1 hour and further away, and they don't have time to visit them as much as they want to. They don't have time to help them as much as they want to. It creates a lot of tension in the family because they feel guilty. They need to do their own things. They have their teenager children, many instances, to take care of, and they don't have time to help also they create tension among the siblings that usually one sibling is a main caregiver and the other just unable to help. Our program can definitely help because we are go to the family, we talk to them, we explain what it is, we monitor the health of their loved one, and we're making sure that all the aspect of the daily living is taken care of.
It sounds to me like there is as much care given to the patient as it is to the relation or the family member who's arranged these.
Right. We give attention to the whole family because we can't just treat the patient as a patient. We have to treat them as a whole a family member, and obviously to be in contact with everybody and making sure that everybody knows what's going on. And if some action needs to be taken, we'll inform them as well.
Now, who is eligible for this program, or how do people get in touch to start arrangements for minors?
It's very easy. Just visit our website, www.bayshore.ca or minorshealthcheck.com, and start right there.
So you can just log on and find out the pricing, find out, are there different packages for people who need different levels of care?
Usually it's a monthly package.
Fantastic. Polina, thank you for giving us this, albeit small, window onto a very large issue facing so many families in Toronto. I appreciate it. Bayshore.ca is where you can go to find out how to find the care that your family may need. And here's more info on Bayshore. Thanks, Polina. I appreciate that. You did a great job.